podcast, Preventing Operator Assaults, is a helpful look at the problem of conflict in and on our community transit systems. We hope that by starting a discussion that includes practical tips and ideas, that we can keep transit operators safe in every community, whether they serve in an urban, rural, or tribal transit environment. This project is funded by a grant from the Federal Transit Administration to improve safety for professional bus drivers and public transit riders throughout the nation. Your host is best-selling author and Transit Unplugged podcast host, Paul Comfort.
Welcome to Preventing Operator Assaults. I'm Paul Comfort, and this is a limited series podcast funded by the Federal Transit Administration to help public transit operators around the nation learn how to prevent operator assaults. Excited to have with us today Dr. Marilyn Dillon in Oklahoma City, and my good friend Kristen Joyner, our co-host. Kristen, will you introduce our guest?
I sure will. Dr. Marilyn Dillon is the Mobility Management Administrator and ADA Coordinator for EMBARK, the City of Oklahoma City's public transportation and parking provider. Marilyn earned a Bachelor of Science, a Master's in Business Administration, holds a PhD in Organizational Leadership and Management, and is certified in Lean Six Sigma. Marilyn serves on the Oklahoma City Mayor's Committee on Disability Concerns, the Oklahoma City Healthy, Hopeful Community Collaborative Advisory Council. Marilyn was recently named the Oklahoma Transit Association's Transit Professional of the Year and received the Lynn Institute's 2022 Legacy Award. EMBARK's mobility services and programs have been featured at numerous regional and national conferences, and the EMBARK Climb program was honored with the 2022 Innovation Award from the Oklahoma Transit Association. So with that, Dr. Dillon, I do want to pick up on that last thing we talked about, the Climb Ride program. Can you tell us what that is and what you did to put that in place that would allow drivers to be safe while serving people who have recently been released from prison?
Yes, thank you, Kristen. So the Climb Ride program was developed in cooperation with the Community Transportation Association of America and the Oklahoma Transit Association and EMBARK, who's the public transit provider here in Oklahoma City. The funding source for that grant was a private foundation grant from the Arnold Family Foundation here in Oklahoma City. It was $1 million grant over 4 years. The charge to us in that grant was, can you develop a scalable, replicable model to address transportation gaps with child welfare cases while simultaneously moving the needle on outcomes and helping parents close their cases and reunify their families faster. So we started together. We used a lot of design-based, person-centered type innovation, had a lot of meetings with people within the child welfare system. And the one thing I want to make sure for your listeners is that they understand the difference between the two sides of that system. There is the child welfare side that works with the parents, and then there's the foster care side that works with the children. So I want to make it clear we were working on the child welfare side. Our goal was to develop this program. We are in our 4th year. We've come in significantly under budget, and the foundation's agreed to extend our grant period another year to allow us to finish spending out the funds. But what we have done is embedded a mobility coordinator and a wraparound service model within DHS, the Department of Human Services, to work directly with caseworkers. She manages all mobility for the parents in these cases. When we started the Climb Ride program, about 35% of the cases in our local county were being reunified. The rest of those cases went to termination of parental rights and adoption of the children. It was taking about 18 to 24 months for all of that to happen. Given that it takes $4,000 per month per child to support them in the child welfare system, any time that you can shave off the length of that case is saving the state money. Currently in Climb, we are reunifying 63% of our cases, so we've doubled the success rate. In addition, we do it in a much shorter time frame. Our average case length is about 16.5 months. We've closed them in as quickly as 12 months, and we've never had one go over 18 months. The other amazing thing about the Climb Ride program is this is a program that is setting up parents for success. It is not putting a Band-Aid on the fact that they don't have a ride to go get something. It is a full wraparound model where we are preparing them for the future, preparing them to exit out of the Climb Ride program and still be able to maintain their transportation network. And we're doing it at a substantial cost savings.
That's great. So I understand that a key part of the CLIMB program is empathy training for the drivers. Why is empathy training crucial, and how are you implementing it there?
Well, it's interesting that you should ask that because the empathy training and our training in trauma-informed training also goes along with another huge program that's happening across the state of Oklahoma, which is called the Science of Hope. This came out of the Schusterman Center at the University of Oklahoma in Tulsa. Dr. Chan Hellman had developed the Science of Hope. We have integrated the Science of Hope into all of our mobility programs. So we are working through this program with our participants. But at the same time, we realized that the Science of Hope applies to our employees as well. So we wanted to provide them that training in the Science of Hope. We have developed underneath the Climb Ride programs in partnership with CTAA, trauma-informed training to help teach our bus operators to have more empathy when they are engaged with someone that's in a critical situation. Oftentimes, when you're in a situation where you're involved in trauma or you're even just having flashbacks from trauma, those external stimuli that you're getting from the people that you're interacting with, if they're negative, it just amps up your trauma. Whereas if you have someone that's empathetic, that is listening to you, that's understanding where you're coming from and what it is you're trying to say, that situation calms down. So it almost becomes you layer the Science of Hope with the trauma-informed training, and you're de-escalating a situation.
So, Marilyn, there's a situation that happened this last year at EMBARK. There was a critical situation for a rider. And my understanding is that other riders on the bus wanted this person who was acting out to be put off the bus. But your driver read the situation differently because of the training that he had had. Can you share what happened?
Certainly. So we all know that transit is really focused on addressing the problem of human trafficking. I know, Kristen, that is one of her projects that's near and dear to her heart, and it is to us as well. Here at EMBARK, we have a lot of social service partnerships. And so we have a partnership with the Family Justice Center here called Palomar that handles domestic violence as well as human trafficking and elder abuse victims. Through that partnership, we've been able to provide a lot of additional training on how to recognize signs and symptoms, as well as the training that we've given our bus operators on trauma-informed training. So our bus operator was on the bus. A young lady got on his bus. She was acting very erratically. She looked scared. Like Kristen said, other people on the bus thought perhaps she might be having a drug or a mental episode, and were actually asking to have her removed from the bus. He realized right away, because of his training, that something more was going on here, that the girl looked very scared. He maintained contact with her, assured her that she would be safe on his bus, kept her on the bus with him, and took her back to our main depot, or what we call the downtown transit center. Once he got to the transit center, he was able to get her inside the building, connect her with the female route supervisor, who again had been through this training, recognized what she was seeing almost immediately, and went to our Palomar driver, who was on a break at the time. And our Palomar driver went and ended up taking this young lady, who had indeed been a victim of human trafficking, to our local agency. She was able to get some support, some assistance. I don't know a lot of details about her case. What I did learn was that she had been trafficked across 15 states. And the only reason she was here in our city was just that they had stopped for a break, and she had been able to get away from them long enough to get on board a bus. And so it's a miracle that she was able to. We did try to follow up a little bit. Obviously, it's confidential and they can't share details, but we are assured that she has been stabilized and has decided to make Oklahoma City her home, is now employed and safe.
Wow, that's wonderful. Just shows you what some of this training can do. It can save lives. What other type of training are you offering frontline employees so they feel safe, confident, and effective on their jobs?
Well, we actually very much today. We have a security consultant that is developing a new series of de-escalation training that is specifically geared to what our bus operators are asking for. So those consultants are actually down the hall in our conference room right this minute, interviewing bus operators, interviewing security staff at the transit center, interviewing the individuals that answer the phone and have to deal with customers, just to find out where are all of the issues at, what are the things that you're experiencing, because we would ask them to customize de-escalation training specifically for a transit administration. We talked a little bit about the HOPE training that we try to do with everyone. We've done the trauma-informed training. We also bring in regular speakers to our quarterly training. So, for example, we have a group here called North Care that manages a mental health outreach team. They came to our last quarterly training, spoke to our route supervisors. They are now part of our case management system that we use here at EMBARK. And we can actually call them or the police department's mental health outreach team at any time of the day or night. And they will actually respond to us and help us de-escalate that situation and get someone connected to resources for whatever the case may be that they need.
So, Marilyn, I think in the transit industry, a lot of people say, well, aren't we just driving? Don't we just need to train people to drive the bus? And how do you even have time for all this other training? And so can you just speak to that in our last couple of minutes of this?
I think transit agencies absolutely have to make time. And I think we have to put forth the information is because what I tell our new hires when I go to the new hire orientation class and introduce myself to them, I said, I bet you guys all think you're here to drive a bus. I said, guess what? I said, we hired you to do customer service. You just happen to be driving a bus while you're doing it. That's what we expect out of you. And that's how you need to approach everything. We are here. We approach everything at EMBARK as though we are here to serve the citizens of the city, and they are our family, and it is our job to take care of them. And that is the kind of mindset that we want them to have, that we start building with them from the day they walk in the door here.
I think that's wonderful, Dr. Dillon. It's beginning with the end in mind, right? Like Stephen Covey said, one of the 7 habits of highly effective people. And that really is what public transit is all about, is serving people, not just transporting them from A to B, but serving them, making them, opening up opportunities for mobility for them everywhere. So thank you for the work you're doing there in Oklahoma City and for being our guest today, as well as you, Kristen, for co-hosting. Thank you for listening to this limited series podcast, Preventing Driver Assaults. I'm Paul Comfort. Stay safe out there.
All comments, tips, and ideas are the express opinion of the individuals and do not necessarily reflect the opinions of Transit Unplugged, the Federal Transit Administration, CTAA, SWTA, TTI, or their subsidiaries. Thanks for listening.